Welcome to H&HN Daily. I'm Susanna Hopsolern, Senior Editor for Hospitals and Health Networks magazine. A collaboration between two independent critical access hospitals has former competitors thriving today, beginning with a joint community survey that identified the outmigration of services in both communities. The facilities developed a joint medical staff development plan and then solicited interested specialty groups to provide regional clinics, as a result, retaining more patients in the area. Today, I'm joined by John Solheim, CEO, Cuyuna Regional Medical Center in Crosby, Minnesota, to discuss this successful rural collaboration. Welcome, John.
Thank you.
Can you describe this historical provider relationship?
Right. Well, it's a tale of two traditional small towns that were rivals on the athletic field and other events. Very proud of their independent hospitals, and worked on and off on a few things, but really, in the end, have come together to develop something that can stabilize both facilities. But really, it's been two independent hospitals that have tried to do the best that they could by themselves, and then hopefully through this process, some of that's changed.
What was the game changer for you?
Well, the big one was, I think, the community survey. And so through the strategic planning process, there was the consultant said, have you guys ever thought about looking at a strategic or a community survey? And instead of looking just myopically of individual strategic plans, did a pulse in the area and found out that a lot of outmigration was occurring. We're located close to Minneapolis, St. Paul, about 120 miles north, and there was a lot of outmigration going there. And so that was interesting. So instead of fighting over the patients in between, which there were 3 or 4 of them, it's looking at that outmigration and then deciding how to deal with that and how to move forward collectively so that both could benefit.
What were some of the barriers that you encountered?
Well, I think some of the barriers are the specialists try to, they say, well, we're busy in Crosby and not in Aiken or vice versa. And so they say, well, we want to do more time or cut one out of the area. And so you can't do that because each community depends on that specialist coming there for their reputation, for their ease of patients. And so I think really sitting down with them and stressing it's all for one and one for all, and that's the process. But we also turned it around and said, well, if you're so busy in one community, you can push patients to the others. And some of the specialists mouth dropped and said, you're willing to give up some of those patients to go to the other? Yes, because it's important for that specialty to be supported here and support each organization. So that was one barrier. The second thing is just how do you manage all that? How do you support those specialties coming through and how you hold them accountable? And occasionally you have to have crucial conversations, I call it, when you have to sit down and say, here's the data. It appears that some patients are going elsewhere. Tell us what's going on. Is there barriers or lack of equipment? A lot of times it was fairly innocent. They just didn't have the equipment they needed or asked somebody that didn't follow up. And so there's a few barriers, but mostly it's that once you get the physicians, the local physician community understanding what it takes to support, it goes a lot smoother. And they took the lead, very visionary, very directional, made a big difference.
What's the role of the CEO in this collaboration?
Well, it's the facilitator because, again, the physicians both hospitals are physician-led, and their direction and their vision is very important. It starts with that. And then it's the deals that get done and the processes underneath that I think the CEO does. Also, you have to set the tone of collaboration. You can't try to, that your staff feels if you're competitive versus collaborative. And so you have to fight that urge not to compete, but be open to say, well, what's good for the other community is good for the other one because in aggregate. And I think the CEO sets that tone and kind of follows through with that.
What are the critical success factors to this type of a collaboration?
Well, one of them, it was surprising to me, is that brand development. You develop a brand that isn't physician-centric about a physician, it's about a service line. And our physicians have, I've had lots of brands before. I really, to be honest, never got it before in my previous years, but the physicians really said, you have to promote the service line.
How is this collaboration improving patient care in your community?
Well, I think it's providing greater access. So that's the key in small rural areas. You have to have access, otherwise people travel. So you have access to a wide array of specialists. We have attracted very excellent surgeons and family practitioners because We can attract family practice because we have good surgery support. We can attract surgeons because we have good facilities. And so it makes a difference for those access to the people. Secondly, we have some linkages with regional players that we have, better procedures that we can do up here in consistency. And then across communities, it helps with kind of that support of maintaining 4 general surgeons instead of each of us maintaining 2, and they turn over. And so that consistency of care has grown, and then the progressiveness of the doctors of what we offer benefits those people locally.
Thanks for joining us today.
Thank you for having me.
I'm Susanna Hopsallen with H&HN Daily.